She just kept saying, "Mommy, I want to go home. Mommy, I want to go home."
Those were the words her sick toddler said after visiting and waiting for hours at 2 BC hospitals.
It takes a lot for me to take my kids to the ER.
Rachel Thaxton took her 2-year-old daughter to the ER out of dire concern and desperation.
Her fever has been continuing, going into the 6th day, really nasty cough.
First, they tried BC Children's Hospital.
The triage line was out the door.
Making the decision to go to another hospital, this time in Burnaby.
Hopefully wouldn't be too long, but there was going to be a wait.
But for the next 6 hours, they waited.
There hadn't been anyone, a nurse, a doctor, no one had come in to see her, take her temperature, check her, or anything like that. It was 4:15 in the morning. My daughter had a lot of trouble sleeping in that bright environment.
So they left without care.
I said, it's better for her to get rest. I'm going to see if I can get help tomorrow.
Health officials admit there's been an increase across the province of people visiting emergency departments due to respiratory illness in November.
Over the last period, we have seen an increase overall in November on average from where we were in September and October.
Fraser Health says it's sorry to hear about this family's experience. Its priority is the health, well-being, and safety of all patients. Adding, we've recently seen an increase in the number of children, in particular those 5 to 11 years old, presenting to the emergency department. Our emergency departments utilize a triage system to ensure patients with urgent and emergent healthcare concerns are seen first.
If you are concerned about your child, not to delay going to the emergency department.
Dr. Bonnie Henry suggests parents still go, even though it's busy.
If you need to go, the emergency department will be there for you, and we are working behind the scenes to make sure that we maximize that as much as possible.
But this mother wants more done.
I defend our healthcare system constantly because I think it's fantastic for the most part. And this is the first time in my life when I've felt that I could see it crumbling. I think our kids are in trouble. I think our kids are not getting the care they need, and they're not getting it in the time they need it.
Health officials claim measures are being put in place to deal with the increase of people at hospitals.
Those who can be in long-term care and are slated to be in long-term care, that some of those people are able to move to long-term care to create more space in the hospital. This allows us to improve flow from emergency room, and that's really important for everybody who works there and everyone who gets care.
Alana Kelly, Glacier Media, Vancouver.